safely managing your condition from the comfort of your own home.
Home monitoring helps patients detect changes in their health early on through their vital signs and their weights and symptoms that they're having, which helps them stay out of the hospital.
Those dealing with chronic conditions like heart failure, COPD, and high blood pressure can enroll in Lee Health's remote patient monitoring program. Participants are given a kit to collect their daily vital signs.
The kit entails a pulse oximeter finger device, a scale, as well as a blood pressure and a tablet app, where then patients would measure their daily vital signs and transmit them via our platform for us to review and then determine if additional follow-up interventions are required.
Nurses monitor this data and look for any trends.
You're assigned an RPM nurse who works with you throughout the program. If there's any type of problem, she will bring it to an RPM provider that you were assigned. The RPM provider will then decide what needs to happen from there.
The health data will also go onto the patient's medical record.
So not just our team, but your entire care team can look at it. Your cardiologist, your lung specialist, your primary care, and together we can make changes.
Remote patient monitoring has reduced the 30-day hospital readmission rate by 50%. For Lee Health, I'm Devin Turk.